Hello everyone. Today in this class we are going to talk about homeopathy and external application. One question. Have you ever wondered why Samuel Hahnemann, who was the founder of homeopathy, was initially opposed to external application, yet later allowed them under certain conditions? This apparent contradiction has puzzled students for generations. So in today's lecture, we will explore how and why Hahnemann's view on external application was changed. There are certain aphorisms in which he has explained the rationale behind it, and we will appreciate the significance of 284 and 285. For that, we have to go back in history and check the historical background of it. Since ancient times, physicians have applied medicines directly to disease part of the body, whether it was ointment, lotion, pulses, or herbal paste. Local treatment was a common medical practice. However, Hahnemann came and he challenged this conventional approach. He believed that disease is not merely local, but represent a disturbance of the entire living organism. It's not a part which is affected, it's the whole person who is affected. Therefore, simply treating the visible lesion may not constitute a true cure. This was Hahnemann's words. In the fifth edition of Organon, Hahnemann strongly criticized the indiscriminate use of external application. According to him, local manifestation are often expression of internal disease process. What he said, like if a person is sick, don't give, and he has eruptions, that doesn't mean that the eruption is on the skin. There is some internal issue. So he strongly criticized that if we suppress these manifestations without addressing the underlying disturbance, what will happen? We may lose valuable information needed for remedy selection, right? Thus, external application may interfere with the principle of classical homeopathy. So if you want to practice classical homeopathy, you can't use homeopathic external application now and then. It was Hahnemann critics, and if you'll go to the aphorisms of fifth editions, you will get that. Now, what are the argument given by Hahnemann on external application? He had two major objections. The first was local symptoms will disappear prematurely, and the second, once it is disappear, what you will see, the physician will lose the most characteristic sign which was required, which was the important indication to for individualization, which on the basis of what you are going to treat the patient. If it is gone, we can't treat, right? So as homeopathy depend on the totality of symptoms, suppression of local symptom make accurate prescription difficult. And the importance of internal treatment is complete cure relies on addressing internal disease. If you can understand the disease itself, only then you can treat the patient. External remedies, as I said earlier, remove the vital sign and it complicate the diagnosis. You can't treat the patient. No. Now let us understand aphorism 196 and 197. At this point, Hahnemann addresses an important question. If a medicine is truly homeopathic and capable of curing a disease, why not give it both internally and externally? After all, wouldn't it make the patient recover faster? Yeah, at first this may look reasonable. However, Hahnemann cautions us against this approach. He explained that in local disease, that the external manifestation often provide valuable information about the internal disease state. Suppose we apply a medicine externally, okay, and the lesion disappear very quickly. The patient may be delighted, okay, yeah, it is gone now. The physician may also feel that treatment has been successful, and can we confidently say that internal disease has been cured? No, we can't say that. The premature disappearance of local symptom may create a false impression of cure. The physician loses an important indicators that help assess whether the disease process is still there or not. Is it still active or not? Therefore, Hahnemann advised caution. The objective of treatment is not merely to remove visible symptom, but to eradicate the disease in entirety. Means we have to eradicate it. This is the key message what Hahnemann said in one aphorism 196 and 197. Now I want you to imagine a situation. A patient comes to your clinic with chronic skin eruption that has present for suppose 20 years or 10 years, maybe many years. Instead of prescribing a constitutional remedy, the physician decides to apply medicine only on the affected part. Within a few days, the eruption disappears. At first glance, this seems like success. The patient is happy. The skin looks normal. Everything appears perfect. But Hahnemann asks us a very important question. Have we really cured the patient? Or have we simply removed the most visible sign of the disease? In this aphorism, treating local disease only by external application is not acceptable. That has been given in this aphorism. When we take a case, what help is in selection of remedy? The striking peculiar symptom, right? The symptoms that makes one patient different from other. The symptom which help in individualization. Now, what is left with us now? Only vague complaint. The patient may say, doctor, I don't feel energetic, or the doctor, I am not feeling just well like that. So how you will come to a simile Mumbai, those vague cases? In trying to remove the symptom quickly, we may lose the very clue that could be have led us to a complete cure. So the central message of this aphorism 198 is never sacrifice the characteristic symptoms merely a sake of temporary relief. A true homeopathic cure requires understanding the whole patient rather than the affected